Today I will discuss you the different types of pelvises, true and false pelvises, right? Now, regarding different types of pelvises, we have four types of pelvis. One is gynecoid type, which is present in all the females and it's normal. I mean, normal delivery is possible in the gynecoid type, right? First is gynecoid, then we have an android pelvis, which is present in case of males. Then we have anthropoid pelvis, which is present in case of apes, and then we have platypoid, which is exactly opposite the anthropoid, right? So the first one is present in females, that is gynecoid type, which is 42%, right? Android is for males, which is 32% only, right? Now, so what in case of the female pelvis, the outlet is the inlet, outlet and cavity. So for understanding this, we have to know about what is inlet, what is outlet and what is true and false pelvis. So first we have to differentiate what this line. The pelvis which lies above this line, this one is the false pelvis, and the pelvis which lie below this line is the true pelvis, the roomier cavity. This is the true pelvis and this one is the false pelvis, right? So what is the line of demarcation is this. So let's count these things. So first point, posteriorly we have sacral promontory, sidewise we have ala of sacrum, then we have linea terminalis. So linea terminalis include iliopubic eminence, pectinate line, pubic crest, right? So on both sides we have the same structures. So these are the boundaries. Below this line is the true pelvis and above this line is the false pelvis, right? False pelvis is more wider as compared to the true pelvis. So I will repeat the boundaries. Sacral promontory, ala of sacrum, linea terminalis. Linea terminalis means iliopubic eminence, pectinate line, then we have pubic crest, right? Opposite side same, pubic crest, pectinate line, iliopubic eminence, right? So this whole line is called linea terminalis, and here again ala of sacrum and sacral promontory. So this is the demarcation. This is true pelvis, this is false pelvis, right? Now let's differentiate between male and female pelvis. So in case of the male pelvis, this is inlet, this is outlet and this is cavity. In case of the male pelvis, the outlet is heart shape. In case of females, it is triangular, right? The cavity is small and deep in case of males, while it's roomier in case of females, right? So outlet is also small or in case of males, while it is larger in case of females, right? So regarding outlet inlet we have finished. Now the other differences are subpubic angle is 50 to 60 degree in case of males and it is approximately 70 to 80 degree in case of females, subpubic angles, right? Now this obturator foramen, they are also triangular in case of males and oval in case of females, right? These are the minor things. The markings, the different markings present on the bone are more marked in case of males as compared to females, like preauricular sulcus, right? And other markings. Then we have an important difference called chilotic line, CHILOTAC, chilotic line. So chilotic line extends from, if I hold one pubic bone, it rises from line extending from iliopubic eminence to the iliac crest, this line. So in case of females, this is the pelvic part, this is the sacral part. So pelvic part is larger than the sacral part in case of females. So this is smaller as compared to this. So this is a male one. Let's see this. So this part is larger than this. So this is a female pelvis, right? So chilotic line, pelvic part is more as compared to the sacral part, right? So this is the differences between male and female pelvises. Now we will discuss the different pelvimetry. Pelvimetry means measurements of the pelvis. So it includes different diameters. We have three diameters: anterior, posterior, transverse and oblique diameters of inlet, cavity as well as outlet, right? So in case of inlet, the anterior posterior diameter extends from sacral premonitory to the upper part of the body of pubis. This is anterior posterior diameter, right? In case of inlet. Transverse diameter is the maximum diameter between this, right? And oblique diameter is between the iliopubic eminence to the opposite sacroiliac joint, right? Iliopubic eminence to opposite sacroiliac joint. This is the oblique diameter. So anterior posterior diameter is 11 centimeter. Transverse diameter is 13 centimeter and oblique diameter is 12 centimeter in case of females, right? So this is inlet. Now come to the cavity. Let's start with the anterior posterior diameter. So anterior posterior diameter extends from the upper boundary of the sacral 3 pieces S3 to the midpoint of the symphysis pubis. From the upper part of the S3 vertebra to the midpoint of the pubic symphysis, anterior posterior diameter. Transverse is the maximum diameter. Then we have oblique diameter of same. It arises from the one sacroiliac joint to the opposite, obturator, midpoint of obturator membrane, right? So this is oblique diameter. So all the 3 diameters, anterior, posterior, transverse and oblique, they are 12 centimeter. 12, 12, 12. AP 12, transverse 12 and oblique 12. Now come to the outlet. So in case of outlet, anterior posterior diameter extends from the tip of the coccyx to the lower border of pubic symphysis, which is 13 centimeter. Outlet, lower part of the pubic symphysis, inferior margin of pubic symphysis to the tip of the coccyx, right? This is 13 centimeter. Then we have transverse diameter, which extends between 2 ischial tuberosities. It is 11 centimeter. Ischial tuberosity, here it is ischial tuberosity, this is 11 centimeter. Then we have oblique diameter. So oblique diameter extends from sacrotuberous ligament of one side to the ischiopubic rami on the other side, right? Sacrotuberous ligament is attached on the sacrum tuberosity to the opposite iliopubic eminence, and it is 12 centimeter, right? So these are the measurements of the pelvis. This is called pelvimetry, anterior, posterior, transverse and oblique diameters. So this is all about the measurements of the pelvis. Thank you very much, students.